international meeting on hypertension has been held in Brescia from the 12th to the 14th of January this year, and it has been organized by the European Society of Hypertension. The title was ASH Update on Hypertension and Cardiovascular Protection. In this meeting, several aspects, new and less new aspects related to this topic have been discussed. The discussion was quite lively and useful, and the presentation of several experts in this field have been really outstanding. The purpose of the meeting was to give an update on this topic and to discuss mainly some issues that still need a precise answer on how to deal with some clinical problems. In particular, it has been indicated that a very important factor is the adherence to treatment, which may be simple, but it is really crucial in order to reach the goal of reducing cardiovascular events in patients with hypertension. This may be obtained in several ways, but it's really one of the most important factors for the success of treatment. And we have to control during time to monitor the behavior of control of blood pressure and of cardiovascular events in the population using big data, using the data that may be obtained using large records of characteristics of patients and behavior of their disease. It has been clearly demonstrated that the hypertension, at least an increase of blood pressure in the younger population exists in children and adolescents. The detection of increasing blood pressure should be made quite early in life. It has been suggested from 3 years of age. Anytime that somebody is in some health situation should have blood pressure measured. And this may be related also to the increase in the incidence of overweight and obesity. It has been also discussed the problem or the characteristics of hypertension in women and the consequences on the heart, the vessels, and kidney. Well, one important issue is how far blood pressure should be reduced in hypertensive population. And it has been realized that treatment should be personalized, because several subgroups of patients and several individual patients may take more or less advantage from a consistent reduction in blood pressure according to their clinical characteristics. What is probably most important is to recognize that blood pressure should be always reduced when systolic blood pressure is equal or above 140, and that reduction probably should be more marked at an early phase of the disease in the young, and perhaps a bit less in more advanced diseases in patients at high risk. In this population, we have to distinguish several subgroups. Some may take advantage, and some may have an increase of side effects from consistent reduction in blood pressure. This is also related to the issue of residual risk despite optimal treatment, because with advanced disease it is very difficult to regress organ damage. There is a sort of irreversibility. While additional risk factors should be treated appropriately. And we have also discussed the possibility that new risk factors should be treated accordingly. And this may include, for instance, an increase in uric acid, an increase in heart rate, an increase in sympathetic nervous system activity, and also the issue of renal dysfunction. But for this approach, probably we need additional controlled clinical studies. So this meeting, in my mind, was very useful as an update, but it opens new questions that should be answered appropriately in the near future. So we look forward to repeating this meeting in short term, perhaps next year. Thank you.